Today, I'd like to address what might be the most important tool that a dental office can use to involve the patient in making a dental buying decision. In fact, without these, the patient has absolutely no tools to tell you what it is they want, and then you slip back automatically into the old routine of telling them what you see and trying to talk them into doing what you say that they need. Well, what is that tool? I hope that you've already guessed that I'm referring to the photos. Good photos are worth 1,000 words, and that means that the doctor won't have to use the 1,000 words that he or she normally uses in explaining to the patient the process and get the pressure on the patient into doing the treatment. And I think that we'd all agree that it will be good news because now you won't have to talk so much, seeing that you can let the photos do the talking. Now, giving the patient the tools that they understand is critical for them to become emotionally involved in the decision-making process. They can't use an Explorer nor a dental mirror to determine if they have cavities and gum disease. So I'd like to review 3 of the many essential steps to making this all work. First, when do you take the photos and on whom? Number 2, how do you best use the photos? And third, what are you and the patient looking for in the photos? Now, the when answer is quite simple. Photos are generally taken during the hygiene visit, and so that for the most part means that the hygienist should be taking the photos. Hygienist, that puts the burden on you to make sure your photography skills are up to snuff. Great photos are a must, as it not only helps the patient see the big picture, no pun intended, but it also is a reflection on the quality of care in the office. If you feel like you can improve your skills, call the company who sold you the camera and ask them for a refresher course. You don't have to get fancy, just competent. Most of the patients should be candidates for photos, both new patients and existing patients. It is usually easier to introduce photos to new patients. We fear that our existing patients might think we're up to something, and we are, I guess. We're trying to help them get what they want, and the photos help them seek beautiful long-term solutions. Make sure that the patient knows that there is no charge for the photos, and they are useful in helping the doctor in diagnosis. Next, the best way to use the photos. Here are a couple of do's and don'ts. Number 1, don't make the patient feel like the purpose of the pictures is to show them what's wrong, or that you're trying to prove to them that your recommendations are valid. Now that's very, very pushy in my opinion. Again, let the photos do the talking. Normally the patient will see something they don't like, but some think their ugly, worn out teeth are fine. Whichever the case, the key to this part of the process is very critical. It's critical because we are sometimes at a point that we can't resist showing them what's wrong, and from our point of view, we look into cracks and fillings and wear and puffy red gums, receding gums, adfractions, etc. And if you do that, you're on the road to confusion. But exercise some self-control and hold on to your horses. That will come later. Here's the critical part. Have close by some photos of the doctor's work that he or she has done on a previous patient. Don't have too many. Try to select photos that demonstrate a similar result that the patient should expect. It's not necessary to bring the pictures of the before pictures of the restored patient's mouth, just the afters, because that muddles up the situation and can create a confusion. Lastly, what are you and the patient looking for? I don't know about you, but the photos bring out things that I often overlook by using a mirror alone. I can see cracks, wear, etc. that don't appear quite so readily without a nice photo. For me, they are a helpful diagnostic tool. But what about the patient? What are they looking for? Most of the time, they don't know what pathology looks like. All they see is pretty versus ugly, black fillings versus natural looking teeth. Those teeth that show you those in the photos could be, again, a previously treated case. If they ask, you could tell them what you see. Then you might say, how interested are you in taking care of your teeth before a crisis happens? Or would you like me to share with the doctor your feelings about your mouth? I repeat, if you're not taking photos, you're being pushy. Many of you have used them for a long time and have seen great success. But you know as well as I do that your photo system could be even better with a little training and time to review it often. Until next time, I'm Dr. Chris.